Patient 2, Lori. The first day of her last menstrual period was March 23, 2020. Today is August 23, 2020. In this case, we are going to calculate both the estimated due date and the gestational age by using the information provided. These calculations are important because they help determine how far along the pregnancy is and guide important medical decisions during patient care and transport. If you calculated her estimated due date to be December 30th, 2020, you are correct. Now let's walk carefully through the math step by step so the process is clear and easy to follow. Start with the first day of the last menstrual period, which is March 23rd, 2020. According to Naegele's rule, the first step is to subtract 3 months from that date. When you subtract 3 months from March 23rd, 2020, you get December 23rd, 2019. Next, add 7 days to the date. When 7 days are added to December 23rd, 2019, the new date becomes December 30th, 2019. Finally, add 1 year to the result. After adding 1 year, the estimated due date becomes December 30th, 2020. This is the patient's projected delivery date based on the information given. Now let's calculate gestational age. Gestational age tells us how many weeks pregnant the patient is at the current time. To estimate this, compare today's date, August 23rd, 2020, with the estimated due date of December 30th, 2020. From August 23rd to December 30th is approximately 17 weeks remaining until delivery. A full-term pregnancy is considered 40 weeks. Subtract the remaining 17 weeks from 40 weeks total. 40 minus 17 equals 23 weeks. That means Lori's estimated gestational age today is 23 weeks pregnant. At 23 weeks, this pregnancy is considered to be at the threshold of viability. This means the fetus may have a chance of survival outside the womb with advanced neonatal care and immediate medical support. Because of this, clinical decisions become extremely important. If Lori goes into preterm labor today, the response plan would be very different than it would be for a patient who is 38 weeks pregnant. Transport decisions, destination hospital selection, and early notification to the receiving facility all become critical factors in patient care. A hospital with neonatal intensive care capabilities may be required because a 23-week delivery carries a high risk for complications and requires specialized treatment for both the mother and the baby. Accurate calculation of estimated due date and gestational age helps providers prepare for these situations and communicate clearly with the receiving medical team. That is why this calculation matters. In emergency medicine and obstetric assessment, even a small error in these calculations can change the entire clinical picture. Knowing the correct gestational age helps healthcare providers understand the level of fetal development and the potential risks associated with preterm birth. At 23 weeks, the lungs, brain, and other organs are still developing, which means immediate specialized intervention may be necessary if delivery occurs unexpectedly. This is why providers must calculate carefully and verify dates whenever possible. The estimated due date is not simply a calendar prediction. It is a critical reference point used during assessment, communication, documentation, and treatment planning. Gestational age also affects how receiving hospitals prepare their staff and equipment before the patient arrives.